Three. Thank you, Christy. Okay, why don't we get started? It's about 12:03. Want to start. We'll have some time throughout this presentation for some questions and reflections, especially from our Cost Growth Target Advisory Committee members and especially the members of the work group, the Cost and Equity Work Group that came together last year to develop this cost and equity framework. So if you have any reflections and you are part of those committees, I'm going to be pausing throughout the presentation a couple times and asking for any reflections. If you have them, please feel free to raise your hand, and I am monitoring whether you're raising your hand. I'm monitoring the chat, and I'd be happy to hear from you and hear like your reflections on things, especially because I personally wasn't in these conversations. I just read all of the notes, read all the materials. Um, and I also have the cost programs manager, Sarah Bartleman here, who led this work from the OHA side. And I'm hoping Sarah is going to back me up really effectively on the different items that we're going to be talking about today. But we'll go ahead and get started. First of all, my name is Remy Watts. I use she, her pronouns. I am the interim administrator of the Cost Growth Target Advisory Committee, doing some work in other areas of the program. But I'm here until the end of August to help support Sarah in the administration of the Cost and Equity Advisory Committee. And today we're talking about one of my favorite subjects, which is operationalizing equity in our work. I have been doing a lot of equity policy analysis for the last, 6 years. Technically, like way longer than that, but I've really been focusing and honing in on my skills on this over the last like 5 to 6 years. And I don't necessarily have a background in healthcare cost affordability, but I do love to talk about strategies to operationalize equity in work. And this is a really exciting concept for me to think about and talk about with you here. And I'm really hoping we can't necessarily have a big formal discussion because this is not necessarily a public meeting where we are going to be taking action, but we are going to go through some history, some what are other states doing topics before we move into the background of the cost and equity framework, and then moving into some pre-identified opportunities to continue promoting equity in the cost target program, as well as some barriers, and think about some next steps that we can take as a group to continue operationalizing equity in this cost growth target program. Okay. So moving on. So this is where we're going to start with some background setting. So we're going to be talking about just some equity definitions, and then also we're going to get into some questions of like, what is the literature on this? Like, what's the background that we're working with? What are other states doing? So just to set the tone here, wanted to share this definition of health equity that the Oregon Health Policy Board, OHPB, and Oregon Health Authority operate under. So this is a defined health equity definition that we have across the entire agency. And basically it's saying that once we will have a health system that is equitable when all people can reach their full healthiest extent. There are no disparities that exist between different population groups based on some of their different identifications, and everyone has what they need to be healthy. And then the second part of it says that to do this, we've got to collaborate together. Everyone's got to be able to talk about it. Everyone's got to be able to come to the table and feel comfortable sharing their experiences. So this is the definition of health equity that we've been operating under for a few years now. And it also sets the tone for the rest of this presentation and the rest of this work. So just wanted to level set here. And another thing that I wanted to level set on is actually, you're going to see it says racial equity, and in the early childhood systems, the 4 levels of change. So just kind of ignore early childhood systems. This is actually a slide that has rang true to me for several years now. I was working in early childhood policy for a long time before I came over here. And early childhood system building is really just a fancy way of saying social determinants of health for families with young children. So I think that this is a really applicable slide, even though it's from my early childhood days. But I think it's a really, really helpful framework to think about equity in system design. I actually was pulling this slide for this presentation and I realized I was misremembering them. I always remember the four levels in my mind as the individual, community, organizational, or institutional, and then the systemic slash structural. And I wanted to encourage you as we go through this presentation to think about you as the individual and your power in supporting health equity and reducing health disparities at the different levels of change that you are a part of. So, like, as an individual, what is your power? As a community, how do you think about eliminating health disparities and promoting healthcare affordability and access? How do you think about those things institutionally or structurally? So, just using this as a framing, there are going to be different equity interventions at these different levels. And I think this is just a really helpful framework to kind of parse through all of the different strategies that swirl around in your brain and decide where to land those. Okay, so now we are past just some general level setting. And now I wanted to talk about some of the different proposed strategies to advance equity in healthcare costs and affordability. So there are a few different sources that we can think of when we're getting inspiration for building equity into cost growth target programming. Um, I've put there we have a few that we can think of. I put two right here. I'll send out these slides. There are links attached, so if you have the interest, you can go and click and actually read these articles. But so NASHP, the National Academy for State Health Policy, and the Center for American Progress, they have noted that leveraging payment systems to enable community investments is a great way of. This is an equity strategy to build into your health system. So we're talking general here. This is not necessarily just aimed at cost growth target programs, but this is like a strategy to advance health equity around healthcare costs. So like broadly, as opposed to just in the cost growth target program. So leveraging payment systems to enable community investments. So translating that, that's going to be talking about like leveraging social determinants of health here in Oregon, like promoting population health and making sure that payment systems support that. Improving chronic care management, combating market consolidation, establishing quality benchmarks and incentives, and then prioritizing population health and data collection. So we're thinking about keeping things local, keeping high quality standards and keeping benchmarks high so that we can all be aiming for the same target in terms of promoting population health and using data collection to ensure that we are meeting that population health. And I'm wondering, I said that I was monitoring the chat and it went away as soon as I went here. If you have any questions or want any clarifications, please drop into the chat. I've got it pulled up right here and I'm watching it. So if any of this feels confusing or if you have any clarifications, please feel free to drop in the chat and I will answer them as we get to them. So once again, just like some really general lit review, like these are some proposed strategies around advancing healthcare costs and affordability. I really love this additional uh, uh, study from the Commonwealth Fund, state strategies for slowing cost growth in the commercial market. So you'll see number one, implement a healthcare cost growth target. So once again, this is just a general way of promoting equity in healthcare costs. And the number one thing that Commonwealth Fund is recommending, Oregon's already ticked off. Like we have a healthcare cost growth target, we've got the program, we're moving forward. But looking at the rest of these, promoting the adoption of population-based provider payment, I'll let you read through the rest of them as I'm talking. These are all really, really great inspirational strategies that we can use when we're thinking about how do we build more equity in the way that our cost growth target program functions in Oregon. Some of these are really directly applicable to some of the conversations we've been having recently, like containing growth in prescription drug prices. Prescription drug prices have been a main conversation topic of the Cost Growth Target Advisory Committee. We've identified prescription drugs as a cost growth driver in Oregon. How can we think about containing growth in prescription drug prices to build more equity? And then from there, how do we like really hone in on reducing disparities in prescription drug access that we can track? So now this is the only real blog post that is centered around ensuring healthcare cost targets promote health equity. So this is the only real like standard that we, or not necessarily standard, but this is some of the only information that is available nationally on how to tailor equity into the cost growth target program itself. And this comes from the Milbank group, and talking about the design, the analysis, and the reporting, these three different ways. So when we're thinking about design of the cost growth target program, what are the populations that are included in the cost growth target measurement? What kind of representation do we have on governing bodies? So with this, like in the design, I'm thinking about the cost growth target advisory committee has the predefined structure approved by the Oregon Health Policy Board that has representation of different players in the cost per target program. Is that representation like, is it fully representing everyone who is affected by the cost growth target program? And like thinking about these like critical analysis questions, moving into analysis, like monitoring for negative impacts, like looking at cost drivers and defining and measuring affordability. Like these are the strategies that we can like dive deeper into. Like we are doing monitoring for negative impacts, but what does that mean? Like how can we further identify what is causing healthcare access disparities for folks and affordability disparities? And then with reporting, we're talking about using appropriate language. So when it says appropriate language, I read that as being plain language. So using language that is accessible and using language that is able to be understood by a wider population. Because when we're talking about healthcare cost growth targets, it's a pretty nitty gritty program. It's a lot of like technical language and really trying to break that down. And as Sarah just added, like appropriate language also includes not blaming people or groups for their costs. And Sarah, I want to encourage you to come off mute and talk about any of this like primer information as well. Because I think that this is all really, really interesting. And I don't know if there's anything that you want to add to like the information that I've been sharing.
No, keep going, Remy.
Okay, cool. Awesome. And so all of this, I also really want to reemphasize that a lot of the work in this space has been super high level and not specifically within cost growth target programs or cost containment efforts, except for this Milbank white paper that we're talking about right now, which is a white paper on sustainable healthcare costs. So there are various points in cost-growth target implementation process when states can consider or incorporate healthcare equity so that they can measure and address inequities, which we're going to talk about a little bit later. But this is all really, really high level. And let's see. Sorry, I'm making sure that I'm not missing anything from my talking points, and I think I am ready to move on. So just really setting the stage. Most of this has been very high level, not necessarily centered in cost growth target programs. So I guess I'm also priming the point that I'm making in this entire first section of the presentation, that Oregon is really kind of setting the stage for this nationally. We don't really have anyone to look at and see what is the precedent for this work. We have a lot of tangential information that we can use to feed into our analysis, but really a lot of other states are looking at us and what we're doing. And that's true across a lot of different sectors, which is really exciting. But it's also a lot of pressure because we're trying to set the stage for something that other people are going to be looking at. And we really want to do it right the first time. So scraping up all of the applicable information from around is going to be really important in informing our next steps. Oh, oops. Wrong advance button. So now I want to talk about some of the things that other states have been doing that are near what we're talking about. So there are a couple of states that are working to inject health equity into some sort of cost containment. And Massachusetts, once again, on the slides, there are links on the slides, so you can go and check out these different publications. But Massachusetts practices for bringing an equity focus into work products. So basically, Massachusetts has named three different ways of asking questions as these are analysis questions for when you're developing work products. And like number one, has the issue been named accurately? So like when you're speaking to observe disparities or inequities in data or other findings, it's important to be clear that the sources of those disparities is often not race or gender or place of origin. It's generally racism or sexism or xenophobia and other structural forces. So like naming the issue accurately. Whose voices are being elevated? Is there an opportunity to amplify the voices of people with lived experience, allowing them to speak to their own situations in their own words? Ideally, these perspectives would be gathered through surveys and focus groups or other mechanisms that allow people to speak for themselves. But when that's not practical or possible, we want to look to trusted intermediaries to provide that perspective. I want to note with this question that Oregon Health Authority is really strong in the community engagement that OHA has been building up over the last, 10 odd years that I've been paying attention to the Oregon Health Authority's actions. Like the community engagement has gotten so elevated and advanced in this agency. And we have a lot of information that doesn't necessarily directly tie to like cost growth target program or affordability, but there is a lot of community engagement that exists within OHA that may contain some information about how individuals or how families feel about healthcare costs, like what would make the biggest impact in their lives if we addressed it first. Like what affordability concept can we address first to make the largest impact? There's a possibility that that information is available to us in our community engagement somewhere, but it's also important to think about like how do we deepen that community engagement within OHA and like the Oregon Health Policy Board. And this last question that I think is really interesting to think about is like, can valuable context be provided? So a lot of inequities are rooted in historical policies or beliefs. Are there opportunities to provide some of that context in the material? Um, a good example is when writing about Black people experiencing housing insecurity, is there an opportunity to provide relevant context about restrictive housing policies? If the topic is addressing stigma and bias related to opioid use disorder, has the impact of a zero tolerance drug policy been explained? So thinking about like in the grand scheme of historical inequities, historical actions, like how has historical decisions gotten us to the point that we're at now? So I think that this is just a really interesting framework to think about um, from Massachusetts. And now we're going to get into a couple of examples from Connecticut, very small state with a lot of big health equity work going on. So the way that their framework, they have the unintended consequences measurement plan. So now we're thinking about how do we measure these unintended consequences? We know we should be looking at that. We know we should be like looking at measuring disparities. How do we want to do that in the context of affordability? And I really love this analyses from Connecticut. There are three main domains of analyses that can measure the effects of cost growth benchmark of concern, including any unintended consequences. So I love measuring consumer out-of-pocket spending. Like, how are our policies measuring consumer out-of-pocket spending? We are aiming to get the cost to the consumer the lowest that it can go. How are our policies impacting that? How are our policies impacting marginalized populations? What are the healthcare access? What does the healthcare access for marginalized populations look like? And are we monitoring it? And as well as underutilization. Underutilization has really been an interesting concept to me, thinking about like Oregon has something like 98% healthcare coverage. So, in theory, by having that level of healthcare coverage for individuals, we should be pulling healthcare costs down because everyone's covered. There aren't any people who are going to be walking to the hospital and not be able to pay for the healthcare that they need to receive. But now we're operating in an environment where that's the truth, but we're seeing underutilization of healthcare insurance from like individuals who are enrolled. Like, why is that underutilization happen? Like, what is the root cause of people underutilizing their healthcare? Are there unintended consequences from some of the policies that we've been handing down that lead people to not utilize their healthcare? Um, I really feel like these are really interesting framings to think about, like when we're doing a critical analysis on how to select strategies in Oregon that will bolster health equity in the Cost Growth Target Program. And one more example from Connecticut. And if we have time at the end of the webinar, after we're done with everything, I really want to go on to the CHI, the, first of all, great government acronym, Connecticut Healthcare Affordability Index, the CHI. And it is a very, very useful dashboard that Connecticut has, that is looking at using uh, the base understanding that families should pay no more than between 7 and 11% of their healthcare household expenses to healthcare. So this is the understanding: families shouldn't be paying more than 7 to 11%. Let's look at families with different demographics, like different household sizes, different household languages, and see what the healthcare spending of these different populations looks like. And the CHI, it's a very, very cool website where you can go kind of like play around and say like, I wonder what healthcare costs for an immigrant family with English as a second language is compared to a United States born family with English as a first language. Like, let's look at those healthcare disparities. And I think it's very, very cool that Connecticut has a tool like that that's available publicly. So it's not only available to policymakers, but for advocates and people in the healthcare system who are trying to identify potential policies within their sphere of influence that might be able to help reduce those disparities. Because if we're all working on reducing disparities and have the same target, then maybe we can actually make a dent in the system and make healthcare more affordable. So, like I said, maybe we'll have some time at the end, and I've got it pulled up so we can click around, and we'll look at how cool it is. But now, the next thing I want to do is move into the draft cost and equity framework. And now we are rooted in Oregon. So we've just looked at the national, um, stage setting. We've looked at what other states are doing. And now we're finally coming around to, okay, this is where Oregon is. We are starting this journey together, and we have some really exciting opportunities coming up that we can take advantage of. But wanted to show like the current snapshot of where we're at in this draft cost and equity framework. But first, obviously, a little bit of background and history to how we got here. The Cost Growth Target Program was passed in 2019 Oregon State Legislative Session. I'm sure most of you know that, but for anyone not knowing that who's listening, I didn't know that until I started this job. So there's no shame in not knowing the history. And when it got passed in the 2019 legislative session, the first task was getting a cost growth target implementation committee together to provide oversight on the implementation design. And I think it's important to note that when former Governor Kate Brown appointed the members to the Cost Growth Target Implementation Committee, she directed them to ensure that healthcare equity, I'm quoting here, healthcare equity is a key component of the Cost Growth Target program with a focus on inequities and reducing disparities in healthcare. So these strategies that you see are the recommended strategies that came out of that initial cost growth target implementation committee to work to incorporate quality and equity into the cost growth target program. And we see these reporting on a standard set, monitoring for negative impacts, improving equity. Now we're going to look at it. Here's a little bit of plain language. The recommendations again, but written in some plainer language. So looking at these, ensuring no harms to quality and access, what negative impacts are we worried about and what do we want to make sure we're watching for? And then what did we miss and how can we make it better? It's going to be important to define what success looks like from a consumer perspective and consider consumer-centric measures in all of the above strategies. Committee members have also emphasized the important cross-market strategies. So we're trying to think about what are the cross-market strategies that we can center consumers in? So just as a general rule of thumb, when you're building equity, when you're thinking about how to build equity and in policy making, there's, top-down policy making and bottom-up policy making. And in my personal experience in operationalizing equity, I've found that 80% bottom up, 20% top down seems to be a really good blend in my mind. Listening to consumers about what their experiences are and what difficulties they've had and what barriers they've had. And then it's our job to translate those experiences into policies to help support access and help support the whole receiving like the general benefit. um, I also think it's important to note that not every cost containment policy or strategy directly contributes to advancing health equity, but they will create some mechanisms or infrastructure that can facilitate health equity efforts and support further change that should always also be advanced. So just because it doesn't have the term health equity in it doesn't mean that it's not advancing health equity in the larger sphere of the work that we're doing together. Um, and I'm going to obnoxiously encourage Sarah to come off of mute again whenever you feel appropriate, Sarah, if you think that I'm missing anything or if there's another piece of context that you want to add. Just feel free. I'm monitoring the cameras and the chat. So whenever you want to do that, just come off mute, go on camera, and I will open up the door for your commentary.
Remy, I think you're doing an amazing job explaining the path. I do just want to add one piece here, which is that, this is where the implementation committee left off in 2021. We've moved some of these forward in addition to the cost and equity framework. We do have a draft monitoring framework. We do have some of this. I'd say that we haven't fully realized this body of work yet. We really haven't fully implemented all of these committee recommendations and really moved forward looking at quality, looking at access, in addition to the work on equity. So just acknowledging that this is also a work in progress.
Yeah, totally. I think that any equity building in any sector is a work in progress. And I think that centering equity needs to obviously be something that we call out in our discussions, but centering equity to me means a lot of analysis questions that are aimed at supporting access to everyone who is in the system and people who have historically had difficulties or barriers to accessing the supports in the system. So like we just said, equity doesn't have to be in the sentence, but equity has to be centered in the intent of the sentence, and we can all make that happen together. Okay, so a little bit more background. So now we're moving on a little bit more. We're going on in our little timeline. We've gone from 2019 to 2021, and now we are in 2023. So a lot of you probably remember all of this, but a lot of you probably remember this part in particular because it's still pretty fresh in our memory. This is just the snapshot to understand. I just wanted to quickly understand the charge of the cost and equity work group that came together last year and actually created this framework. Um, as you can see, the work group was charged by the Cost Growth Target Advisory Committee and OHA with creating recommendations on steps to further integrate equity into healthcare affordability work. So that's just the point of this slide. We just need to understand, like, there was a work group established, and they were charged with making recommendations to the advisory committee and to OHA on steps to further integrate equity into healthcare cost containment efforts. Really broad deliverable charge, and I think it's really interesting. We're about to start to get into the cost and equity framework itself. So this is the way that the work group interpreted this deliverable, and I think it's a really interesting like interpretation, and a really applicable interpretation at that as well. So moving on, we are finally at the actual cost and equity framework. We're here, y'all. This is the topic of the meeting. And we're going to look at what the actual draft framework looks like in just a second. But just like kind of describing it, it's about 10 pages. Oh no. I'm sorry. I had a little bit of a dog explosion in the background, but so the work group have interpreted the recommendations and created a highly actionable document, the cost and equity framework, that, sorry everyone, I have a very small house, and we're working on actually making an additional space for me so that I can have a working space outside of dogs. But you know, that's where I'm at right now. Anyway, so the work group interpreted these recommendations and made a pretty highly actionable document called the Cost and Equity Framework, that is essentially operating as a menu of options for the different partners in the Cost Growth Target Program, that everyone can consider to fortify their system. So we're talking about centering your power, thinking about what is your power within the system, like where do you sit and how can you control the things around you, to center healthcare affordability. So there are a ton of ideas and potential opportunities for a range of parties, including the legislature, the advisory committee, Oregon Health Authority, health plans, and provider organizations. And it's organized at a high level around these 5 goals reflective of the Cost Growth Target Program, which are listed here, and we'll dive into each goal in the next few slides. But very important to note that the draft framework is incomplete. There are some past and current activities that may not be listed, and there are additional discussion of potential activities that we need to have, which is obviously going to be a next step that I'm going to list out, but especially for payer and provider organizations. So moving on to this next slide, this is literally a screenshot of the draft framework from the Word document. So when we're thinking about the whole document, it's a 10-page document. It's draft, it's got the draft watermark all over it, don't worry. It has a background section, some guiding principles that are driving this framework, potential opportunities to integrate equity throughout the Cost Growth Target Program cycle. And then, of course, there is a source section, which I think is a very valuable resource for anyone who is interested in understanding equity strategies in cost growth affordability. So this is just a screenshot of the first goal in the potential opportunities to integrate equity section. If you're looking this at the top, there's always going to be the goal at the top of the page, and then there are several strategies that can meet this goal. And then there's a table below every goal that has past and current activities and then potential future activities listed out for the different players in the system. So the legislature, OHA, the committee, and then payers and provider organizations. Once again, this is these are draft, there are probably definitely some past and current activities that are missing. There are definitely potential future activities that can be added. This is a work in progress, and this is a collective work. So highly recommend or highly encourage everyone here to think outside the box. Don't limit yourself to what's in here. Like, you can center these equity analyses questions to help understand how you can use your power in your piece of the system to control it, to help reduce disparities in healthcare affordability. So these next few slides, we're going to be kind of running through these goals a little bit. We're going to be putting all these pieces together in a few minutes, but just wanted to go through and just highlight the 5 different goals, or 6 different goals, 5 different five goals, and look at the different strategies to meet each goal. So, goal 1 is all around identifying strategies to bolster health equity from the program design of things. So, we're thinking about ensuring appropriate representation of partners in the advisory committee's work to focus on the program's charge of reducing disparities in healthcare access. We're thinking about designing the cost per target program to promote tenets of data justice. Um, we want to continue to build trust and engagement within the committee and with other partners across the health system to ensure all perspectives are heard on the committee and encourage broad public comment. So I really love all these different little like objectives to meet the goal. Moving on to goal number 2. Some of these are a little bit shorter than others, just FYI. That first one I think is kind of the longest one, but goal number 2, measure performance relative to the cost growth target. So we're thinking about collecting data for as much of the population as possible to make cost growth target performance measurement more comprehensive. While goal number 1 included how to design data practices, goal number 2 is focused on expanding the amount of data collected, including more populations and more indication of affordability to make the cost growth target performance measurement comprehensive and accurate to all populations. So part of this is going to be exploring adding affordability targets and complementary to the cost growth target. Oh, and Sarah is putting in a great note in the chat. An example of progress for goal 2 in this year's report released on Tuesday, we included data for spending at the Oregon State Hospital for the first time. So that's a very cool example of progress for goal 2, like collecting data for as much of the population as possible. And especially the Oregon State Hospital, that's going to be serving a lot of like low income folks, like people who are on Medicaid, Medicare. So that's a really, really great example, Sarah. Thanks for throwing that in. So goal number 3, analyzing spending to understand cost growth trends. Oh, did I just do that? Oh, sorry, everyone. Sometimes you just click and something happens. Analyze the spending to understand cost growth trends and cost growth drivers, goal number 3. So this one is aiming to center data analysis in equity, like looking at the disparities of cost drivers in the healthcare systems among providers, like looking at things like geography, population, affiliation. Another way of looking at this goal is stratifying data where possible to identify differences in price utilization and per person spending by service category and in aggregate. So just one thing I know, I've worked cross sector for a long time, and one thing that all sectors are challenged by in this equity work is the lack of data and the lack of being able to stratify data and look at aggregate data to support health equity, building health equity and building equity just in all types of systems. So I want to reaffirm that this is not just an issue in this sector, like this is a cross-sector issue that everyone is working on. And one thing that I think is cool is like one action that falls within this goal, as well as within OHA and the state's larger priorities. So like I just said, cross-sector, is the need to measure investments in health-related social needs. So health-related social needs is a larger strategy by the Oregon Health Authority. It's a larger strategy named by the state of Oregon, the whole state of Oregon. And that falls within this goal of like analyzing cost growth drivers and like expanding data analyses to identify disparities. So other actions that fall within this goal include like monitoring for negative impacts. So we were talking about monitoring for negative impacts earlier. All of that conversation falls within this goal. And then also monitoring for neutral impacts, like things that aren't working the way that we envisioned. So we're going to move on to goal 4, performance and analytics. And I'm going to speed it up a little bit just because I want to get to the next section and we are getting a little bit shorter on time. Um, Goal 4, report performance and analytics. So thinking about like how we can improve community engagement, all of that conversation that we just had, making accessible and inclusive language, and then also identifying measures for equity, like what measures are we actually looking at that are going to paint the narrative of what's going on in different populations experiencing different disparities in healthcare affordability. And then goal number 5, accountability. How do we incorporate equity considerations into all accountability mechanisms? So this goal is relatively straightforward. I think a really great example of this recently was actually in the recent accountability rulemaking. Shout out to any of my colleagues who are on this call who have been working on that project. And they were developing these financial penalties for people like entities that don't stay within the cost growth target, and those are being developed right now. We've got the public hearing coming up. But something that I really loved was that there was a carve out where pediatricians and federally qualified health centers are not exempt from the cost per target program, but they are exempt from financial penalties. And I think that this is a really great example of creating accountability, but incorporating equity considerations into the accountability mechanism. We're protecting healthcare access to children and their families, as well as rural and low income populations, while also supporting these providers in improving their accountability or affordability mechanisms. Um, Another really great thing that I think we've done recently around incorporating equity into the accountability mechanisms was acknowledging that investments to improve population health and health equity are considered good reasons for exceeding the cost growth target, which is pretty cool. I just really, really loved that example as well. And in my own interpretation, this is my own interpretation, I think that one of the next big opportunities for imbuing equity into the accountability framework will be in the performance improvement plan design, which is going to be coming up next in this accountability rulemaking accountability arc. And so finally, goal 6, identify and implement opportunities to slow cost growth. I feel like this goal is almost an umbrella for everything else, but it's all about what is used to monitor cost growth. So we're thinking about ensuring policies and strategies have been analyzed for impact on health equity. So some of the ways we can do that: monitoring behavioral health spending. Behavioral health spending has been shown to be a cost driver in Oregon, probably the rest of the nation as well. That is an editorial, not fact. It is fact that it is a cost driver in Oregon. I don't think we're special in that. But like monitoring behavioral health spending and seeing how we can support that spending to be encompassed within cost growth target, evaluating the impact of implemented policies and strategies. Um, at OHA, we recently have the Health Equity Impact Assessment tool that was developed by our health equity team. Actually, fun fact, in conjunction with Michael Anderson Nath, we are so lucky to have somebody with that kind of expertise on our cost growth target advisory committee. But the Health Equity Impact Assessment tool, I was actually the first program to use it in my last job at OHA. And it is a really, really amazing framework for thinking about like just an entire program, thinking about the entire cost growth target program, or you can get into the different aspects of the cost growth target program and use the health equity impact analysis to identify opportunities to vet potential strategies and or policies for cost containment. Okay, so now we're going to move on, but file away these last goals in your brain because I'm going to hit you with a couple pieces more of information before we come back to these. But just remember, we've got these 6 goals with these different subgroups, and we'll come back to those in just a second. And before I move on though, Sarah, do you have any good examples, besides the ones that I listed that you want to share, that are like really great examples of any of these goals?
No, I think this is also part of the work in progress, where as the advisory committee conversations, the cost growth target public hearing next week, ongoing conversations with payers and provider organizations, as we keep identifying these policies and strategies, there's this iterative nature. We have to come back and do the equity impact assessment and do the monitoring. And
Mhm.
that iteration or that cycle just keeps rolling through as the conversation keeps developing across the state.
Yeah, thanks. Okay. And so now, just really quickly, what has happened since the framework was adopted in December 2023? There was a request to get feedback from consultants to collaborate with the Health Equity Committee from the Oregon Health Policy Board, and then a request with the Racial Justice Council to share with the Racial Justice Council. And kind of what's kind of happened is we've done all of that, but we've kind of hit a wall in the work because we need to be figuring out how to make this work um, in our own capacity. We need to figure out how to bolster it from the inside. We've reached out to different other groups that have expertise in this, and they don't have any capacity either.
And
Equity.
let me
Oh,
jump in and add here.
yeah.
So there were three specific requests from the advisory committee to sort of take the draft framework around, shop it, get additional feedback and input, and keep iterating on it. Two of the groups that they asked us to bring this draft framework to are not currently meeting. So there was no opportunity, or there has not been an opportunity in the last 6 months to bring the draft forward and have those conversations. I think we're still monitoring, and as Remy's saying, we do have the responsibility to continue to further this work. We can't sort of just outsource it to another committee or to another consultant, but we do want to have that consultation. We just have not had the opportunity because two of the three groups we were asked to consult with are not currently hosting meetings.
Right, exactly. It's hard to get collaboration with folks when they are not meeting. Actually, I in my last work, I actually ran into the exact same issue with the Racial Justice Council, which is funny. I tried to go work with them and they weren't meeting. Um, so I think it's a really great opportunity though to reflect internally on this is the work that we've set up and we have a lot of opportunities to move it forward as well. And that's what we're about to talk about next. We're about to talk about the opportunities and the barriers in implementing the cost and equity framework. What can we do next? What can we think about? And I want to start with the opportunities because the barrier list is kind of pretty massive but short, but the opportunity list is very, very long. And I love a long opportunity list. So here, this is kind of a red herring. This is the cost growth target program cycle. This is moving through from implementation, identification to implement, measure, and analyze and report. So this is what the cost growth target program is working on at any given time. So all of my colleagues here in the cost growth target program were working on identifying opportunities and strategies to slow cost growth, implementing them, measuring them, analyzing them, and then reporting them. We just put out the 2024 report on cost growth target or annual cost driver annual report. So we're at a really fun point in this cycle actually around the annual report where we just finished up the report and now we're moving back into flowing through the rest of the cycle. You can also make the argument that the cost growth target program is at any point of this cycle at any time. So it's always a good time to jump in. Oh, no, I'm so sorry. This is not what I meant to do. And I also want to note, like throughout the cycle, there are opportunities to integrate equity from the different perspectives. We don't want equity to be an afterthought that's layered on top of cost containment efforts. It needs to be integrated into the work from the beginning and throughout the work, and we have tools to help support this. Um, to this end, this framework, the draft cost and equity framework, identifies potential opportunities throughout the cost growth target program cycle in the framework and all the actions. Um, so here in this next, it's the cost growth target program cycle again, but instead I've inserted some of the different goals that we have. So incorporating equity considerations into all accountability mechanisms in the implement cycle, ongoing monitoring of equity impacts during implementation. Like, you can go around and read these yourself, but these are all of the goals and the objectives to meet the goals from the framework itself that I've organized into the different cost growth target process. So when we're thinking about like where are we in the cost growth target program cycle, how do we take these strategies and implement them and operationalize them? How do we make sure that we are incorporating all equity considerations into all accountability mechanisms? Like I said, we just had a really great example happen with the rulemaking, and I have full trust in my colleagues that they're going to continue doing that accountability or that equity building and accountability work. But how can we, as the Cost Growth Target Advisory Committee, support that work? Like, how can we be thought partners in how to create all of those equity strategies? And I'm going to move into a really complicated slide in our last few minutes. This slide is meant to be complicated. I am not meant to read through this with you. We have so many different partners and players in the healthcare delivery system, and we have a lot of unanswered questions about the overall system design that need to be answered in order to develop a deeper strategy to operationalize equity in the cost growth target program. What does it look like when everyone in the system is operating at their best? What are the desired future states for each group in this Costco target program? So like Oregonians, what does the future state of the consumer look like in the Costco target program? What does the future state of insurance companies look like in the Costco target program? What is the ideal? What are the payer and provider actions for equity, and how do we move those actions forward? Are they voluntary or are they regulated? Is it regulated compliance? Is there a convening in the roles as it relates to cost and equity? Is this all part of the work group's work? Um, Also of note is that all entities involved in the Costco Target Program, including the legislature, OHA, the Costco Target Advisory Committee, health plans, payers, and provider organizations, we all have a shared responsibility to integrate equity into healthcare cost containment efforts to ensure that actions are taken to meet the target and to ensure that they do not cause or perpetuate harm and reduce inequities by improving healthcare affordability. So this is all innovative, uncharted work, and we can't wait for someone to tell us how to bring cost and equity efforts together. And we need to move forward with our best ideas, but recognize that we will continue to learn and evolve. And we may make mistakes, but that's okay. And so the next steps, implementing the cost and equity framework. Next steps. This is the end of the presentation. I'm going to move into resources while I'm talking about these next steps. Next steps are like doing some reading, like thinking about what are these equity strategies? What are these equity analysis questions that we can use when we're thinking about our place of power in the in the system and how we can build the system. Like, these are voluntary efforts. These are voluntary, you looking at these different strategy, different like equity analysis strategy questions and figuring out how to implement them into your scope of power, into your individual place of power. Looking at our cost growth target advisory committee, the next steps might be, do we bring the work group back? Do we bring the work group back as a body that comes together regularly to help inform the conversations that we're having as the larger cost growth target advisory committee? How do we continue building these equity centered strategies to control to control cost growth in the state of Oregon? There are so many actions that are listed out in this framework. How do we get these actions out to everyone who has power in making them happen? It's all going to be driven at the conversation pace of the Cost Growth Target Advisory Committee. And I personally think an important next step is making that conversation happen more frequently and regularly. And that's going to be something that Sarah and I have to talk about with the co-chairs and with the committee to figure out how we can continue to deepen this conversation. Because once again, we don't have somebody holding our hand and telling us what to do right now, and we need to be figuring it out, and we need to be proactive, not reactive in this work. So the next steps are vast and there's so many opportunities, but it's also really hopeful and it's really optimistic that we can make a change happen. And maybe in 10 years, we'll be able to look at this cost growth target program and think, wow, like we've actually moved the needle on affordability in Oregon. We made some mistakes along the way, but overall, we had a really positive impact on healthcare affordability in Oregon. And we're also grateful to have been a part of that journey and seeing like the changes that we've made in healthcare access for Oregonians across the state. Um, I don't know if anyone, we've got a couple minutes left. I'm probably not going to have time to look at the Connecticut Health, the CHI, Connecticut Health Accountability Index, Accessibility Index, excuse me, unfortunately. But I'm wondering if there's anyone on the call who has any interest in like what these next steps are and like helping move these next steps forward and moving the conversation forward.
I'd also really welcome in our last few minutes if any of the advisory committee, work group members, or policy board members have reactions or reflections on
Mhm.
this presentation. It would be great to hear what you think. Did this accurately capture the journey that you remember going on with us? And what are your thoughts about the next steps?
Hi all. Hi all. Sorry, I'll chime in. I only made it for half the webinar, but what I did see, you did an excellent job. You certainly made us seem way more impressive than we probably were. I guess the thing I would just want to be transparent about is that I think our work group and I mean our committee, I think, still continues to struggle with really figuring out how to tangibly integrate this in the cost growth target because there's nothing really signaling that we can find across the country, right? Of others trying to do this. So I think we're trying to figure out as we go along. And clearly, you've seen some really great strategies that have been implemented, and I think there's still just a lot more for us to figure out. And so I think it's going to take lots of minds coming together to try to solve this. So hopefully, others will become engaged in this conversation. So, but thank you, Remy, for such a great presentation.
Michael, it wouldn't have been this way without you. So thanks for that thought and reflection. Well, it's been really great having y'all. Thank you for coming. I'm glad that there were actually some people here to watch me on this presentation. This has been a lot of like thinking and musing and thinking about like how do we blaze a trail in this topic that like there's really no precedent for. And it's really, really exciting to be a part of this work with this team. And I'm really looking forward to what the future of this work brings. And one of my favorite things about being from Oregon and going to a multi-state conference is just being from Oregon and being able to brag about all the cool stuff that we do in Oregon state government. And I really am looking forward to being able to share this information with other states so that we make a change, you know, not just within Oregon, but like impacting affordability for other families and other people in other states in the United States. So I think that this is a really optimistic conversation, and I think we all have a lot of power in reducing health disparities and access. So thanks for joining me on this journey, y'all. We'll send out the slides. We'll make sure the recording's posted and expect this conversation to continue. So in one way or another, we'll make it happen.
Thank you.
Thank you, everyone.
Thank you.
Thank you.
Bye.
Bye.